John, it was great if you can stay on, or John or Roland, one of you, because I think it's a very interesting case here. So let's bring a bit of the machines in, because machines are taking over lots of things potentially, and they're not good at everything. In fact, interestingly, I read something very interesting about ChatGPT getting worse and worse as it's trained on more human data. So AI is a really evolving field, but not one to be trusted. Not yet, I think. So we have a patient who has had a big polypectomy before, so we can do a scar assessment here, but also has also been noted, and this is very important, has been noted to have multiple small polyps on the procedure in which the EMR was done. And actually, that's very important information, because of course we talk all this talk about surveillance intervals and, you know, let's not bother doing the second surveillance or whatever, let's skip them and let's bring patients back. And actually what we have to think is, well, yeah, but what about the other polyps? And so I know that Lobka has views on this, I have views on this. So I think that's a very important point, that, you know, other polyps around are important, and you have to deal with them often in surveillance, because it's usually not appropriate to deal with them at the time of doing a large polypectomy. So the first thing to highlight is that AI is very good at some things, and you can see that it is a very, how can I say it? It is a very nice driver assist tool. So like when you're driving along and maybe you want to have an AI that detects cyclists, for example, and makes a beeping noise when it sees a cyclist that you maybe didn't see, so you wake up a bit from whatever you're doing. But it's not that you wouldn't have seen the cyclist anyway, probably, but maybe you wouldn't have, and then maybe you would avoid an accident, that sort of thing.
It might be over time that we come to this conclusion, and then we also want to screen their first degree relatives.
Also right. Close, please. Okay. Yeah, I mean, those are very important things. So the key point, I think, open is if you find one, there are maybe more, right, Lob?
That's right.
So, yeah. Very difficult position, this. Close, and I knew that. That's why I haven't given it to Ewood. So my training hat on. I'm not giving things to people to just make them feel bad because they're difficult. If I think they're difficult, then I'm going to do them myself. So AI is on. It's not detecting the elephant in the room. So unfortunately, the thing that makes this easy for humans to detect makes it difficult for AI to detect. And so as I get closer, it intermittently detects it, but it's absolutely not as reliable as for adenomas, right? And if there is maybe, yeah, see, the border with no stool is reliably being detected. I think that's what's allowing it to detect this. But you do see very commonly situations where there is a full stool covering on a ulcerated polyp, and it's not detected by AI. You must remember that. You cannot just use this as a brainless tool. So, yes, of course. Okay, I have it.
Two, close.
Very good. Look at that. Excellent. And open immediately.
Open.
Okay, yeah, use the same. No, it's not. It's not, because you're still in the same position. So gently come back. Yeah. As soon as you see the defect, go to the right. So as you come back, we'll see the defect. Come in, hopefully. We're going to shorten maybe too much here. I've got it a little bit where it is. You come back. I'll hold it when I see it. We'll need to insert a lot as soon as we see it, probably.
That's good.
Stop. Okay. Now get ready to find where the defect was from before, and then as soon as you see it, okay. Not easy. Okay. Maybe we need to revise. Yeah, it's not so bad. It's flattened out a bit. Okay. So yeah.
But I need my
diverticulum there. Okay, yeah. You were right on it. So let's go just tip up. No, I've got it. Tip up. Okay. Push out near the diverticulum. Okay, and then sit down, a little bit of suction, you're too distended. Yeah, that's it. Okay, use the shape of the snare to get on that margin of the previous resection. I don't think it matters how much or little tissue you take. The snare's not so open, it should be more open. That's better. That's very good. Okay, control it slowly. You can get the right margin as well if you're just very careful.
Go for the right margin.
Go to the right with a small wheel, not the left. Yeah. No, 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 no.
The right, sorry.
That's the left. That's pretty good as well. If you want to take that,
I thought I need to take the.
it doesn't matter. Okay, push out a bit and let's have a look.
No.
That's looking good. Suction, suction, suction. Okay, good.
Two.
Go now. Look at that.
Yeah.
Like catching a butterfly. It's not a very beautiful one. Okay.